Hello everyone, as you guys already know, 2020 has been a very strange year, and we all know the reason why is because of this reason right here. This little red thing, it's called, that is the certain virus that came from the bats, from the China, from Wuhan. Now, today we're going to talk about how to deal with this virus and some information, helpful information hopefully for the virus. So make sure to hit that like button and subscribe if you like the video and share it with your friends, and let's get started. So as I was saying, first we're going to talk about my own sources. Like, I actually got an information from other sources, well, I'm gonna do that, but first I'm going to write about my own sources that I made with some information, basic information about the coronavirus. So let's go into it first. Let's go into it first, and let's go to facts about COVID-19, and we already see there. So I'm going to let you guys read it, but I will read some. As you guys already know, it says here the coronavirus disease 2019 COVID-19 is an infectious disease caused by several acute respiratory syndrome coronavirus series. SARS. Remember SARS, the old virus? Yeah, it's kind of continuation of that. Not really, but whatever. The disease was identified in Wuhan. Pretty sure you all know that. And after that, this virus became a pandemic on ongoing globe, and resulting in the ongoing 2019-20 coronavirus. As of 26 April 2020, more than 2.95 million cases have been reported across 185 countries and territories, resulting in more than 205,000 deaths. That is more than 860,000 people. But 860,000 people have recovered, so it's not really a big chance, but you still got to be careful. This is why lockdown is going on right now. I'm pretty sure some sports, like everything is going to be fine in some countries like Austria, but I'm not sure. Here in the United States, no, not yet. Especially New York. I'm in California, so it doesn't even matter, but whatever. So common symptoms include fever, cough, fatigue, shortness of breath, and loss of smell. With the majority of cases resolve in mild symptoms, some progress of viral pneumonia, multi-organ failure, or cytokine storm. More than concerning symptoms include difficult breathing, persistent chest pain, confusion, difficulty waking up and walking, and bluish skin. So that is what you gotta be scared of and look out for, because these are the symptoms that the coronavirus that can give you. Cough, obviously the most obvious one, and as people cough, it's literally just they get terrified in case some person has COVID-19. So that's really all you gotta know about it. Experience symptoms, the virus may survive into 72 hours until it recovers or kills you. The standard method of diagnosis is by real-time reverse transcription polymerase chain reaction from a nasopharyngeal swab. Sorry if I butchered those names. Chest CT imaging may also be helpful for diagnosis in individuals where there's a high suspicion of infection based on symptoms and risk factors. However, guidelines do not recommend using it for routine screening. As you guys already, there's no vaccine, so I'm not really sure when it's going to come out. But this is what you gotta know. And we're about to go into the cases that happened. We already mentioned it. Which cases specifically, so for you to be looked out for. So we go here, cases of now. Coronavirus obviously came in and, wait, no, I apologize. I meant to go into cases. Yeah, they're sorry. Alright, Italy and Spain were the biggest victims of coronavirus and still are. Especially with James reported 260 deaths in Italy for the past on Sunday for past 24 hours, and Spain had 288 deaths. That's what they reported also on Sunday, and it was reported in 37 days. The total is in Spain is 23,000 basically, the third highest number globally. So both children in Spain are outside for the first time since the country's lockdown. Other than now, leave homes for an hour stay. So both Italy, we're not really sure how it's going on. Spain definitely took also a big hit, but they're kind of getting that process of going back. Italy, not really a lot of known for. I'm pretty sure France, like Ligue 1 got canceled and something. I don't know. I'm not sure as a La Liga watcher that I'm not sure if it's gonna return, but whatever. England, nothing really, no. So safety tips for dealing with corona. Now this is the main thing here. This is what you gotta do. I'm pretty sure a lot of people already told you about this, but I'm just gonna rephrase it again. So what you go is clean your hands often. Use soap and water or an alcohol-based hand rub. Maintain a safe distance from anyone who's coughing or sneezing. We don't know that. Cover your nose and mouth with your bent elbow or tissue. Sometimes people just wear masks as well. Stay home if you feel unwell. I'm still home, by the way. If you have a fever, a cough, difficulty breathing, seek medication, call in advance. Call in advance. This is very important. Follow directions of your local health authority. I'm pretty sure they're going to give you that. And avoiding unneeded visits to medical facilities allows healthcare system to operate more actively, therefore protecting you and others. That also works, but again, you cannot just rely on them only. You got to protect yourself as well. So use those steps above to help you. So that is what you got to know about my own sources. Now, we're going to take a look at more professional people, because I'm not professional, what they said, and kind of that's what we're really. So what you can do is, one is World Health Organization, as you guys already know. Now, this is way too much to read. As you guys can see, I'm pretty sure you can see there's a link right here. I'm gonna leave the link description below for these sources, from worldwide sources that I got, so you can read them later. Anyways, basically what it says here, it also says, usually I took my information from here, did not copyright or anything, don't worry, did not plagiarize. This is all theirs. This belongs to them. It's theirs. So there you go. They wrote all this. Yeah, I mean, this is what it is. And I'm gonna let you guys read this, but anyways, what you gotta know about the coronavirus is just, it spreads easily. It spreads easily. It's not plague or something, but it spreads. So just be careful and use those tips that we use. And again, this is about suggestions about coronavirus. This is what the doctors themselves wrote. And you can, I'm also going to leave this one. I really feel like this, the one I'm going to right now, Doctors Without Borders, this is a very, very helpful website. You can see all of those more impact information coming on these categories. You can click on them and read them. So they all have it right there. They're just broad, and full information is here. Anyways, yeah, how is coronavirus trend? There's even a video here. I'm pretty sure you guys can check it out. So how dangerous is coronavirus? That is one question that everyone has. Now, as you can see, 80% who got infected will experience a form of disease, a severe form. So as you can see, it will be bad, but you're probably gonna survive. If you're really taking care of yourself, then you're most likely gonna survive. It is a very small chance that you're gonna die, even though a lot of people died. But we don't know. But as now the cases decreased more, and there's really nothing else, you can still, like, it's not that bad. I mean, it's bad, but it's not like SARS. And we really don't know what's gonna happen with that, because SARS only continued for 1 year. Possibly this is also gonna be the same, but we don't know. But anyways, before the vaccine comes out, however, because next year, I'm predicting the next 2 years maybe, there's gonna be a vaccine or something where we need to get them, because in case something like that happens, in case another pandemic. This is not epidemic, this is pandemic, even worse. So it's more dangerous for elderly people, or for people that are suffering some infections or some problems, health problems. If you're healthy and you're still an elder, of course, you can survive. You can definitely survive. So we don't really know what's gonna happen, but what you gotta do is just take care of yourself. And this is why it's recommended from you to stay home and be healthy. I'm just recommending that. And there's also a video right there if you guys do not see that. I'm sorry for panic. Now, health grades. These things again to know about coronavirus, but these are some interesting facts. And this is about if you live in the United States like me, this is what you're really gonna know. And we all know that New York is in terrible spot right now. Feel very bad for. I hope they recover. California is also not really in a great spot. whatever other states. Utah's fine. Florida, I'm not really sure. Yeah, but New York and California are really in a bag. I'm talking about state New York as well. The city is obviously just dead. My friend lives in Brooklyn, so I'm kind of worried about what. So I'm actually worried about him. I hope he's okay. And yeah, I mean now it's not. It's really hard to get in touch. But you guys just gonna know, speak to your doctor about being tested. So if you're tested positive, now I know it's very hard right now at this, especially because you're not really allowed to go outside. But if when you are, always call them. You're gonna get in a. They're gonna get. They're literally gonna poke you with obviously gonna get your analysis. See what they see in your blood. If there's no virus, if you test negative, then it's good. If you're healthy, it's okay. Nothing else. But if you're tested positive, which is depends if I mean for me, I'm not in home anymore, but my mom comes, but I'm not sure if we're even them, but we're feeling okay. Remember, okay, when you're feeling okay, that does not mean that you're actually not infected because this viruses usually don't really make you feel like SARS didn't or something. They don't really make you feel bad. Except plague, but plague does not exist for 100 years or something. So like they don't really make you feel anything. They just there. Viruses are there just to get transmitted there. I'm also gonna leave this here down in the description. So yeah.